James Modesto. Second negative, as Monica said about cost running up so much. Before the Affordable Care Act was law, policies had lifetime caps. Simply put, if your cap was $2 million, you no longer had insurance the moment your insurance spent number $2 million on you. With the Obamacare, according to Obamacare Young Adults, Obamacare WebMD, that's no longer an issue. Meaning, if you have cancer, diabetes, as let me see. Well, nearly half of uninsured young adults report having problems paying medical bills, according to Obamacare Young Adults, Obamacare Young Adults. Half of single young adults who are eligible to buy health insurance at the work market get covered for $50 or less due to cost assistance. I'm not saying that's everybody, but I'm saying for those who can't make it under that poverty line or above it, that could definitely help them out. Young adults who come down with a sudden serious illness or victims of disease can easily reach that limit of $2 million. That's just a low ballpark for, motorcycle accident, something like that. If the Obamacare was repealed, those who were previously uninsured because of pre-existing conditions will again be uninsured, meaning they're kind of just left out to dry. They don't have any other, way of getting insurance. That's it for them. All those under 26 and under, which are now covered, will no longer be covered. According to Clement Marcia from Healthcare CQ Researcher, an additional 3 million young adults have gained coverage in recent years through provisional law that enables dependent children to remain on their parents' health plans until they turn 26. That's according to National Health Insurance Service from the Federal Center for Disease Control and Prevention. If that's gone, they're not, like I said, going to be covered. They're going to have to come up with those costs on their own. They're going to have to somehow come up with that money. As for small businesses, they're not nearly as affected as you would think. %96% of all firms in the United States, or 5.8 million out of 6 million total firms, have under 50 employees and will not be penalized for choosing not to provide health care coverage to their employees. That's according to Obamacare Small Business Facts. The healthcare system is changing. According to Clement Marcia, Healthcare CQ Researcher, the ACA codifies many such changes and therefore is already having a very positive impact on millions of lives. Healthcare cost growth has slowed in part because the healthcare system is shifting in the direction the ACA promotes. As for the success of the Obamacare, according to Clement Marcia, Healthcare CQ Researcher, after the March 31st deadline passed for signing up for health insurance under the Patient Protection and Affordable Care Act, the White House announced that more than 7 million people had bought coverage under the landmark program, dubbed Obamacare. But some healthcare analysis calculated the number was as high as 9.5 million when those who signed up through state insurance exchanges, private insurers, expanded Medicaid coverage were counted. Moreover, the share of enrollees in the 18 to 34 age bracket, the healthiest group of insurance consumers, had ticked up to 27% by February and continued strong in March. Enrollment of healthy people is necessary to spread costs in an insurance pool. Obama and many insurance analysts say there are likely enough younger participants in the ACA program to keep premiums from soaring out of sight. At this point, enough people are signing up that the Affordable Care Act is going to work, Obama said in mid-March. The pool is already large enough. I'm confident the program will be stable. After Congress passed the law in 2010, some 26 million people whose employers do not offer health insurance were encouraged to buy subsidized coverage through the markets, called exchanges managed by states or the federal government. These laws also call for states to expand their Medicaid eligibility requirements so that millions of low-income low-income Americans earning up to 138% of the federal poverty line would be eligible to enroll in Medicaid for the first time. Just do a small recap, just if you try and repeal the Obamacare, lifetime caps will no longer be in place. Except anybody ends up in the emergency room, that's a bill they're not gonna be able to afford. Paying a monthly, X amount of dollars is a lot cheaper than bringing a $2 million bill and then they cut off your service, meaning, except if you have cancer or terminal illness, chronic illness, you're gonna be left out to dry. Pre-existing conditions, you're not gonna be able to get affordable health care like it was before. And those 26 and under will no longer be covered under your parents' insurance as, put in law by the Affordable Care Act.